Hello, everybody. This is Maria Banga, founder of the association Hope for the Abused and the Battered. I want to give you a summary of an interesting webinar I attended on Saturday titled Mental Health in Crisis with Dr. Vikram Patel. Dr. Vikram Patel is a renowned psychiatrist and researcher with the Harvard Medical School, and he's also the co-founder of Sangat, an Indian NGO which has won numerous international awards. So Dr. Vikram Patel was talking about mental health in crisis, and I really appreciated the fact that he did not shy away from using his personal experiences to buttress his conversation. And he talked about, for example, having to deal with the emotions of anger and helplessness when the outbreak, when the COVID pandemic broke out, and the way the government responded with this, what do you call them, confinement or preventive measures. Some of them are really hard and stay at home and everything. Well, whatever. So he said that 5 category of people who are a main concern during this COVID-19 outbreak pandemic, especially as far as their mental health is concerned. So the first category of people are those who have been economically dispossessed, those who can't go to their shops, or those who can't make the same profit or the same business they could do before. They'll be thinking about it, the worry, the anxiety, probably going to search. The second category is old people. They will have to battle loneliness and hopelessness because people are supposed to stay at home, and some old people are already living on their own. Well, families used to come to visit them once in a while, but now nobody can go visit anybody anymore, unless you want to take that risk, which is not advisable. The third category of people he looked at were young people, and he said they were the highest risks for developing mental health problems because, well, they go through their own sorts of emotions and they're not feeling happy about it. They're not in school with their friends. I mean, I had a conversation with my sons yesterday, and it was very insightful. Each person said what they were missing and how they're trying to cope, right? And we are all struggling. The fourth category of people, sorry, are those who are affected by COVID-19, the sick and the caregivers. You can imagine staying at home, it's already stressful, being in the hospital, being quarantined, and not knowing if you're going to make it or not. It is super stressful. And of course, the caregivers, the frontliners, you don't know each day you go to that hospital, you coming back with an infection or not. Then the fifth category, people who are already living with a mental illness. It makes no sense already, and now with this outbreak pandemic, it makes no sense. First of all, there'll be maybe less attention. Everybody is needed now in the other units. They are going helter skelter. They don't understand what's going on. Nobody can communicate effectively with them, so you can imagine. But then he talked about how you can manage your mental health through it all. The first thing is to acknowledge your mental health in the same way you acknowledge your physical health, and be self-aware. It's no more time to shy from talking about mental health and mental illness. It's no more time to stigmatize people. Nobody created this virus. I mean, with all the people who are affected. So there's no reason to be ashamed if you're infected, or to start stigmatizing those who are infected and start saying all kinds of things about them. Yes, we have to be self-aware. We have to accept it and understand what we can and what we can't do. It's very important. And although we still have some limited choice, like nobody is coming to watch me in my house, I can go out and visit my neighbor. But I know that it's not proper for me to do that now. So yes, I accept it and I understand why I shouldn't do that, and I don't do it. I have to adapt professionally and in daily life. Here I am in my room at 5:30 p.m. Normally, back then, I wouldn't even be in my home on a weekday. Today's a Tuesday, right? Professionally, I'm really finding my groove. It's just this week that is beginning to come. The last 2 weeks or 10 days or 12 days were really difficult for me. But you have to introduce some certainty and structure in your life to keep it going. I mean, you're not yet there. You have to live, and you have to keep a routine. Do things we love. I love reading, so I've been reading and just telling myself, well, reading is also building myself up intellectually. Okay, protection of our mental health, especially from misinformation and too much information. I mean, I got trapped again today. I just got something and I was like, oh my God, what's he saying? And I shared it. And then somebody made me think about it again. I was like, oh, I'd already shared it. Oh no. So things are just coming from all angles. And I was telling my friend, this is so confusing. The fifth thing is be constantly aware of negative thoughts. So you're like, oh, what would tomorrow be? I had to go to the market today. Oh my goodness. If somebody touches me, so I had to cover myself and everything. I'm like, but I have to go. My kids are not going to die of hunger. And then, well, everybody is going to die. So I don't really want to deal with those thoughts. I don't want to be watching updates of COVID minute by minute anymore. That doesn't help me. Yes, show compassion and altruism to others around us. Show kindness and goodness. I mean, you can still say hi like that. So it's not like you're walking around suspecting your neighbor. We live, for example, in communities. My community is just like some communities in India. I mean, everybody's keeper. So it's been very difficult now trying to keep people away from home and all of those kind of things. So we have to explain to them in whichever way. We have to share information on WhatsApp. I mean, proper one, especially from the WHO or from the government. And we stay in touch with people, especially those who are particularly at risk of being lonely and isolated in this period. Not everybody has access even to social media and stuff. So if you can call somebody once in a while, please do call somebody. Coping mechanism, you have healthy ones like reading, writing, drawing, singing, dancing, meditation, yoga, breathing exercises. You have many of them. I mean, even eating. What are you going to do? I'm about to go and find some what we call here puff puff. Yeah, I mixed it already. I want it to rise. What else? Okay, fine. So avoid unhealthy coping mechanisms like alcohol and substance abuse, risky behavior like going out of town for no good reason, maybe just to go and visit a friend or just to go to the beach, for example, stuff like that. No, that is risky. And careless third parties. I mean, if they call me now that my father has died, okay, well, you stop thinking like that. And if he comes, say he is not, and so if they call me, then we are going to cross that bridge when we get there. As for now, I don't really think that thinking like this is going to help me. Speak to yourself in the mirror and use this time to build a strong foundation for your mental health and how to support others too through this crisis and many other crises to come in the future. Well, the way forward for mental health awareness and practice: telemedicine, therapy online. I'm a therapist, I'm a psychotherapist. I will talk with people now. I work with them on WhatsApp and stuff. I don't want to receive anybody in my office. I don't even want to go there, except it's very, very urgent. So it's very important for mental health providers to take this seriously, because in the current context of confinement, nobody can go to any therapist's office. Even if I wanted to receive people, who is going to come there? We both want to protect ourselves. We also have to review what productivity is and how much pressure we put on ourselves. I mean, the pandemic has caused us to slow down and to probably think about what it means being successful, being productive. What else can we do? And the other day I was talking about living a simple life. Like, how many clothes do you need actually in this period? What are you dressing up to go to? I mean, I just stopped this way just to do this live video, right? Okay, so it was a wonderful webinar with over 500 people connected from all over the world. Indeed, there is hope. I think it's so scary because it's so uncertain, but um, let's not stop living. As long as we breathe, let's live. Mental health matters. Hope for the abuse. One of our main focus areas is being the hope for people living with a mental health challenge or mental illness. We offer psychotherapeutic support. Listening counts a lot. And so if you want to join or support our organization, kindly email us at hope@hopeforabusebetter.com. I put them all there in the write-up. You can visit our website and you can give us a call or WhatsApp us through the following number: +237 672 576011. +237 plus is 00237 672 576011. And our website is www.hopeforabusebetter.com. Okay, until our next video, I am Maria Banga, founder of the association Hope for the Abused and Battered. Let's say no to stigma. Thank you.